Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Hi everyone, I'm Dr. Ifeanyi. Today we'll be discussing age-related macular degeneration.
Hello everyone, I am Dr. Bature Mustafa. Our guest for today is Dr. Olufemi Oderinlo, a vitreoretinal specialist with the Eye Foundation Hospitals. Thank you for joining us, sir.
Thank you. You're welcome.
Thank you, sir. February is Age-Related Macular Degeneration Awareness Month. What exactly is age-related macular degeneration, and how much of a problem is it in our society?
Okay, age-related macular degeneration, as the word implies, is an age-related disorder that affects the area of the retina that we call the macula. It's usually characterized by a reduction in vision in association with certain clinical findings like what we call drusen and RPE changes. In the advanced form, there may be what we call choroidal neovascular membranes. Those are the type that we call the exudative form of age-related macular degeneration. Initially, the previous studies in our area in sub-Saharan Africa said that age-related macular degeneration wasn't common. But with recent studies, especially in various areas in Nigeria, we have a group in Ibadan, a group in Ife, Lagos group. We also had some studies, Benin, Enugu, Onitsha. Everyone has really come to realize that there's age-related macular degeneration with us. Although most of these studies are hospital-based studies, we realize that patients coming to the hospital are between 3% to 14% of hospital attendees with various factors given from various groups really have age-related macular degeneration. So this disorder is with us. In the National Blindness Survey, which is one of our best data available to date, about 1.8% of respondents were blind in one or both eyes as a result of age-related macular degeneration. About 3.9% of them had severe visual impairment, and 2.4% had moderate visual impairment. So this disorder is with us. These numbers may look small, but when you look at the population, the mild visual impairment among the respondents, 1% of mild visual impairment among respondents. You look at the population of Nigeria, 200 million, 1% of that is 2 million. So definitely we have a lot of this disorder with us. We are just waking up to see it, and it's something we really need to enlighten the populace about. Thank you.
Well, that is quite vision disabling. What are the risk factors for development of ARMD?
Okay, well, as the word implies, again, age will be the first risk factor that we look at. There are certain changes that go on at the back of the eyes, especially in the area of the retina, the thickening of the Bruch's membrane, which gives a likelihood that ischemic changes might happen in the area of the retina, and that leads to overexpression of VEGF factors. So age is number one risk factor. Other risk factors are genetic. Genetic factors are quite important. Some individuals have the predisposition to have uncontrolled expression of complement factor H, and that leads again to inflammation and some other things. So definitely a genetic predisposition is there. Family history is there. The race, although yes, it's more common in Africa, but we know that people of African descent have a reduced likelihood for having age-related macular degeneration when you compare it to the Caucasian. So race is a factor. Other factors will include smoking, obesity, cardiovascular diseases, systemic hypertension, dyslipidemia, and oxidative stress. The sunlight again is contributory to it. So there are a number of risk factors, and definitely there's no group of people that is completely immune to it, but some are more predisposed to it than the others.
Okay, so sir, those are very interesting risk factors that you've told us about, especially age, since we're all likely to get old. That's everybody's hope. So what can be done to prevent blindness from age-related macular degeneration? And what's your advice to the general public on maintaining good eyesight?
Okay, thank you. So you see, generally, like the first statement you made, we cannot stop ourselves growing older. And so it means that we should become aware of the risks that we face as we all grow older. So education and public enlightenment is very important, letting people know the risk that each individual faces, especially, like I said, family history is one of the risk factors. So where there's a family history, the person needs to be aware, and they need to be encouraged to have regular eye examinations, regular checkups, especially for people at risk. It said that the diet rich in vitamins is preventive. Lifestyle modifications, like all other disorders, weight loss, having the ideal weight, control of cardiovascular risk factors. Now, one of the studies we look at these days, the longitudinal study, that's the RH study, the age-related eye disease study, helped us to look at the effect of people using vitamins to prevent this. The summary is that the studies basically noted that the use of certain vitamins and antioxidants only had the advantage of preventing progression to the advanced forms of age-related macular degeneration in individuals with intermediate risk. So for individuals who have intermediate age-related macular degeneration characteristics, when they are given this particular vitamins, it helps to reduce the rate of progression to the advanced form. Again, you can't sit in your house to declare you have intermediate or moderate ARMD. You have to go to the hospital. So very important, the examination, regular examination. People have to see their ophthalmologist to get their eyes checked, and then proper medication can be given for those who can have it, who can have an advantage to reduce the progression, and those are the best ways to attack prevention of age-related macular degeneration: the public health way and also the clinical way.
Okay, thank you for that point. Build upon the RS study. Are there other treatment options? And what are the new advances in the field?
Okay, so the treatment options, there are quite a number, and I think this is where I think my own specialty lies. So we look at treatments. Let's look at it, the non-pharmacological treatments, then the pharmacological treatments, then the lasers, surgery, and even gene therapy. So for patients who just have the early form, maybe the non-exudative form, there are generally two types, the exudative and the non-exudative. The non-exudative is the more common one. So, and it's milder than the exudative form. So for the non-exudative form, um, non-pharmacologic things like giving glasses, and for those who fall into the intermediate group, you can encourage them to use antioxidants and zinc. Then, if they are appropriate, to take the other medications. Then the pharmacological one, which is the more recent one, we have so many of them. Basically, they are targeted at inhibiting vascular endothelial growth factor in patients with the advanced form. So a number of them: ranibizumab, bevacizumab, new ones coming up. Aflibercept is really with us. Brolucizumab, faricimab, which actually inhibits the Ang2 receptors compared to the There are others like the dapin protein inhibitors, the bisepa. So there are a number of pharmacological ones. The more common one you really be coming across will be the top three, which is ranibizumab, bevacizumab, and aflibercept. And I find them extremely effective, especially when the patients are caught early after you are able to pick up a choroidal neovascular membrane. Treatment is usually, in fact, the income of these pharmacologic agents has done a lot to blunt the knife of the surgeon. In those days, surgeries, we used to do a lot of surgeries. Sometimes you have to do a vitrectomy and then make an excision in the retina to remove subretinal choroidal membranous complexes and a lot of all these things. Many of them these days just respond to anti-VEGF. So anti-VEGF is doing very well. The lasers too. Anti-VEGF too is trying to kick out lasers, but there are still some areas where if there are extrafoveal lesions, a thermal laser will be good enough. PDT, transpupillary thermotherapy, we use TTT less now. PDT is still quite relevant for particular cases. And of course, gene therapy, I mean, the aim of that is to get a sustained delivery of anti-angiogenic proteins into the vitreous cavity to prevent the formation of choroidal neovascular membranes. So there are lots of things that can be done to treat the age-related macular degeneration, either in its early non-exudative form or in the late exudative form. And unlike some years back where we just had one or two options, these days we have quite a number of options, and outcomes are really much better than we used to have them. Thank you.
Thank you very much for this discussion with you today, and it's been nice having you with us. Thank you.
Thank you very much.
Thank you, sir, for coming.
Thank you so much, Doctor.